Phosphodiesterase type 5 inhibitors are the first-line treatment that we have for ED. They're oral medications, pills that people take almost always in advance of sexual activity. They work on blocking a reset switch inside of the cells of the penis that would result in the end of an erection. So if I blockade the process by which I turn off that signal becomes louder, it becomes amplified. And so in the patient who's otherwise healthy down there in terms of nerve function and blood flow, these drugs ought to work. There are things that patients will tell me that makes me think that one of the options in this class of drugs makes more sense for them than another. Usually that does have to do with things like some of the specifics of their sexual relationships, their experience taking any of these medications before in terms of side effects, and the other medications that they take. And there are some very unique instructions depending upon which ones you've been prescribed in terms of how you take them, when you take them. Pretty consistently, all of them are going to do better if people take them on an empty stomach, and sometimes that can be something that trips people up depending upon which medication they've been prescribed. And lastly, the patient who's taking heart health medications where you really cannot use these medicines. And I think that's a concept that many people are sort of peripherally aware of, but don't have a complete understanding of. So it's on me to walk people through that until they feel comfortable with the idea, okay, he thinks this is a medication that's okay for me to try. And then we have to walk through what medication will they attempt, what is the dose, what is the schedule, how do you take it correctly, how do you take it incorrectly. But at the end of all that, yes, there's a huge majority of patients for whom these drugs are effective. I would just encourage people who are dealing with this problem, hey, come in and get seen. It will be good for us to fix this for you. It's good for your overall health at the same time.